Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease at any age and tired of any treatments, please call me for second opinion of your treatment as well as of the disease, so that I can guide you according to the nature's principle, how the nature was curing the diseases when there was no medical science. At that time, in the initial times when when there was no origin of the medical science, and automatically people were sick, getting sick, and they were getting cured, and it was a natural principle, and how this natural principle was going on, and how this body was, in other words, you can say how the body was recovering himself. Still, body is recovering itself. Nowadays, we are giving credit to the treatments at this time, but actually the internal truth is that all the medication treatments, whatever we are doing, they are preventing all other complications which may complicate the condition of the disease at that time. Whereas the repair of the body is itself. Yes, we can initiate the repair, and the repair depends upon those minerals, those salts, those vitamins, which are the foundation stone of this body. How this body is formed, we know that it has muscles, bones, and everything, and but for they are composed of, how the muscles are composed of, how the minerals are, bones are composed of, and every organ has been composed, and ultimately we will reach to the conclusions that everything has in it the minerals, everything has in it the vitamins, and all these things. Just like in the initial time, the Dr. Sushler analyzes this body, and I can give you one example of his experiments, that if this whole body is converted into powder, just for example, I just want to explain this thing easily so that you can understand what I mean. If this whole body is converted into powder and then we analyze it, just like in the sand, we take the sand, we take the mud, and ultimately we analyze it, and we can find it out how much is the silicon, how much is the other salts in that one, and all that. Similarly, when this body is made up of powder, everything has been converted into powder, and then we analyze it, and we analyze it, and we find it out that in the composition of this body, as per Sushler, Dr. Sushler, that there are 12 different salts composed in it. And if ever there be any deficiency, if there be any disease appearing inside the system in the living bodies, he was of the opinion, it's according to Sushler, he was of the opinion that somehow the ratio of these salts has been changed in a particular organ, just like the same 12 salts are composed in the eyes, but their ratio is different so that the eye can see. The same 12 salts are composed in ears, but their ratio is different, and we can hear that. So, this is what his explanation is, that whenever this body falls sick by any organs, by any system inside this one, it is all because that any of the salts or any of the ratio normally in healthy condition has been changed. In healthy condition, just like we are having a healthy body, and a healthy body, if it is converted into powder, then we find it out that how much ratio is magnesium, how much ratio is calcium, how much ratio is potassium and sodium and whatever. So in this way, when a person falls sick, he explained that the ratio of all these components of this body powder has been changed. That is why this body falls sick. And ultimately, if we provide those kind of salts to that persons, and those percentage or those that ratio of that salts becomes normal, ratio of those salts may not be one salt, maybe many other salts, they are in deficient, they are having changed their ratios. So if we calculate that one, if we are resulting that one, decided that these are the salts deficient in ratio, that is why this body is sick. And this body is sick because his eyes are foggy, his hearing is lost, his digestion is abnormal, indigestion is there. Whatever the system has been damaged in its function, is not normal in its function, it means some of the minerals which are the components, the normal components of their system, has gone changed. Ratio has gone changed. That is why a system becomes sick. And if we correct that ratio, correct that ratio, the system will recover and we will be healthy. This was his principle. But as we know, there, just like, let me complete this thing, the minerals and salts, all the minerals, all the salts which are composed in this body, they are having their external signs or internal signs on the body, and we can see those ones. Just like deficiency of iron, everybody can easily understand. I can give you the example of iron. Deficiency of iron indicates anemia, and we can judge anemia from the eyes, we can judge anemia from the tongue, we can judge anemia, even we can later on get test in the lab, and we can find out the low hemoglobin rates and all these things. Potassium, excess of urination or less urinations, all these things are concerned with all these salts and different salts. Magnesium, problems in the intestines or problems in the joints, most of the ratio of this magnesium is in the joints and in the intestines. In this way, we can figure it out that what type of body or physical abnormality is in the patient, in the sick persons, and it may be because of, suppose if he's having joint pains. Easily, according to Sushler, we can understand that this is because of magnesium deficiency. And if there are again two things, if the deficiency is because you are having deficient magnesium supplied by your food, whatever food you are taking, it is not supplying the sufficient quantity of magnesium. That is why you are having pain in the joints. And the other thing is that no, the same food the other family members are taking, the same food this sick person is taking. Why he is having joint pains, the other peoples are not having the joint pains? It indicates that the food was not deficient in the magnesium which needs this body, but the assimilation of this magnesium is abnormal, is not correct. That is why from our food, it goes inside the body, it is squeezed by the intestines, and the material which is required by this body, minerals, all the vitamins, everything, whatever we need, that one is squeezed and mixed up into the blood. as a child. In this way, the second condition is that there is a deficiency in that assimilation process. Under those conditions, even if you supply excess of magnesium, it will not work. So we have to diagnose the condition. We have to conclude this condition whether it is because of the deficiency or whether it is because of the deficiency of assimilation of that salt into the body. So this is Dr. Sussler's, you can say, experience or whatever he narrated in the medical science and the history of this biochemical medications, that these are two conditions, but the main thing is the component of those salts, the composition of those salts, and the ratio of those salts. This is what he said. But as we know, there are some vitamins are required, and those are provided by other substances, just like vitamin C is provided by orange and all these sour things and this and that. In this way, different fruits, different vegetables, different things are providing different vitamins, and they are going with the foods, and ultimately they are squeezed from the intestines, and after that the squeezed liquid is mixed up into the blood. Deficiency is completed, and persons do not suffer with any problem. But if it is in deficient in the food, if it is not assimilated from the intestines, these two things may be the important factor for a sick person why he falls sick. And then the purpose of treatment is also concerned with the two things. One is supplementation. Suppose if it is deficient in the food, you have to supplement it. Poor peoples, they cannot provide healthy food to their kids, to himself as well, to the family members, and they may show signs of deficiency. Especially, I can give you one example, important example. When a lady becomes pregnant, first of all, he was eating food and she was normal. She was normal. Whatever she needs for his body is getting from his food. But now she has to serve another body inside his mouth, inside her womb, uterus. She is having another person to feed. In this way, the requirement is increased, and she is having the same food, even deficient. Sometimes you know that in the first 3 months, the ladies cannot eat much. And there is again deficiency of the vitamins, minerals, and many other things. And ultimately, the condition is maintained, and then ultimately she becomes a little bit healthy. But even then, some of the ladies are having deficient in iron, deficient in other minerals, which are shown by the outer signs and outside the body, and we detect, and the doctor detect that one, that yes, you need this one. You need calcium for the development of the bones of the baby inside. Doctor recommend to take calcium. There is a deficiency of iron. Doctor recommend to take iron tablets and capsules. Now there are perinatal and many other compositions we are getting in the markets that they are prescribing for this one to compensate the deficiencies. But sometimes what happens, even after taking these type of things, additional, this is known as supplementations. Supplementation, what is required, what is deficient inside the body, you are supplying in excess. But if the defect is in the assimilation, that government is supplying sugar to the depot holders, but the depot holders are not supplying this food materials or sugar cane or whatever to the public. Then what will happen? The same thing will happen. There is a deficiency of sugar. In this way, if the intestines are not sufficiently strong and they are not squeezing the sufficient material from the intestine or from the food in the intestines, then again, even after supplementation, the deficiency will remain there. The basic thing is that we have to correct the route, we have to correct the traffic, that this traffic should carry this salt, this salt, this salt, so that the deficiency should be completed and it should be mixed up into the blood, and a person should not show signs of any deficiency, and he is healthy otherwise. So this is what I explained you about the Sushler's opinion, and he made 12 different salts, and the combination of those salts, calcium, magnesium, potassium, sodium, all these salts are he mixed in different combinations, and ultimately he make it up to the 12 salts. So that's known as 12 tissue remedies. But 12 tissue remedies are a different kind of preparations. As a homeopathic style, he has made these things that does not complete the deficiency for which we need to supply a supplementations. Whatever a pregnant lady was eating, it was sufficient for her herself. But now she has to feed another baby inside the womb. She need more iron, she need more calcium, she need more other things, fat and all those things, and which is not supplied by this thing, which is not completing the required dose, whatever she is taking, then doctor recommends extra supplementation of these things so that it is covered. This is one part of the minerals. Does not mean that this body is only complete, only composed of minerals. We know to compose, to combine, to join one minerals with the other minerals, we need something. Just like we make a house with the bricks, and to stick the bricks with each other to make the wall, we need cement. Same way, same way, the vitamins are working for this thing, so that all the components, all the 12 tissue salts are helping each other or combining their effect with each other, so that the normal combination, normal work should be performed in the body. That is why vitamins are required. And ultimately, it's a big chain. Ultimately, this workflow should be continued. We know different hormones and everything. So ultimately, this is the long list of all these things. What we need further, what we need further. Again, we will come to know with our knowledge that our body needs many other things. But the basic thing, as Dr. Sushil told us, is the 12 different salts. And the combination of these 12 salts by means of vitamins are they become workable. These mineral salts become workable. If there is a part of magnesium, if there is a part of sodium, they will not work. We need to combine them. We need to combine in the specific ratio for the specific organs. And then ultimately to join each them so that it make a compositions, we need vitamin C. And this way, so it should not be destroyed. It should not be loose. What we need? We need vitamin K. And so just like there is a composition of the blood, you know that the platelets counts. The platelet counts are serving to protect the blood. If the platelet counts is less, there may be more tendency to bleed. It will not stop, and there will be bleeding, and the food and the cells will be destroyed. And if platelet counts are more, it will make a blood thick, and it will be difficult to move forward to supply the food materials, to supply the minerals and all this. So this is a long list of all these things. But the basic thing I want to tell you that this body is composed of 12 different salts, and the deficiency of these salts, we assume as a Dr. Sushler that they are the reasons behind any sickness, that there is a deficiency of any mineral, and also there is a deficiency of a perfect ratio for each and every organ's functioning. Just I told you about the eyes, about the ears, about the nose, about the joints and all that. They are having all those salts, 12 salts, but they are having a different combination, different ratio. It's by nature. It's by nature. Your tractor, your car, your machinery, you start it. First of all, it's only a metal things. It's only a metal thing. But when you start it, gas works over there, it forms a gas, and ultimately it looks like a living process. It looks like a living things. The same way our body, this flow is not going on, we are dead. And if everything is normal, if there's no gas, if there's something else altered inside the body, if there is no mobile in that one, ultimately the engine will not start. The same way, all these salts, if they are not in actually combinations ratio which the nature has provided in the basic formation of this body, then the organs of this body, different organs of this body, will not perform their assigned function. Whatever the function is assigned to any organs, just like the ears I told you, they will not be able to do that one, because the ratio is different. Ratio has changed. Just like we see that excess of diabetes, sugar, excess of salts, there is a foggy vision, all because they are settled over, all because they are making the solutions thick, through which the light does not pass and we cannot see that one. Sugar, salts, they are deposited in excess. They are circulating in excess in the blood, and the same way they are excess in the eyes, and ultimately we lose the vision. We have less vision. The same way about the hearings, same way about the other things. So in this way, so I want to convey you that the first thing is for the treatment is to complete the composition in its normal. And for that, when we prescribe homeopathic combination of all these salts, it means it's not supplement. It means that you are correcting the system so that it can squeeze the normal quantity of iron, of mineral, of magnesium, whatever is required by the body, because the organ is becoming healthy and it is squeezing from the food materials. And if the organs are not healthy, even if you supply the good materials, good food materials, even then they will not be squeezing all that thing, and the person will show the deficiency, anemic, all these things so will happen. So both things, this homeopathic medicines or this biocombination medications, all these things are homeopathic preparations, and they are for the purpose of correcting the error in their assimilation, correcting the errors in your assimilation from the food. All these salts are going to in the food, but they are to be assimilated in the system. So now, if a person is having deficiency in food, it is not supplied normally. Then even after taking Schussler's medicines or even after taking any medications, it will not compensate. And even if it will compensate, you force it, you supplement the things in a large, and ultimately if ever they show the improvements, it will be temporary. And ultimately when you back up from supplying the extra stuff in your food, extra iron things, extra calcium things, and if you stop those supplying the extra things in your food, and ultimately because the system itself, he is just pick he should pick up 100% of the iron, 100% of the calcium, 100% of the fat, and whatever you're supplying, magnesium and whatever. But if this system is damaged and you are just giving the biocombinations and it is deficient in your food materials, it will not work. Even then, you need to supply the food. If there is no gas in your car, everything is normal. You have to supply the gas. You have to supply the mobile oil and all that. Then and only then engine will work. So in this way, this is the normal thing that first of all we should select all these things which are the components of any of body, and if they fall sick, we should assume outwardly that this is because of deficiency of this salts, because all these salts are showing their presence or absence inside the body by external signs. Just like you see there are cracks on the bed nails, you see cracked corner of the mouth, you see there is a dry scales on your skin anywhere. It shows abnormality of the sodium chloride, sodium salt inside your body. You have pain in the joints. It shows that something is wrong with the magnesium composition. You have some problem in your urinary troubles, urinary system, whatever it is. It means something potassium is excess or in deficiency, whatever it is, should be corrected that one. So in this way, all the salts are having their own external indications for the treatment basis. And we should understand that one. So we are passing through a general lecture of this body of different parts, just like we have discussed about the head, and in the head, which is called with brain inside. And if there is any damage in the brain, what are the external signs we have discussed in the previous lectures? What we see outwardly as a mental symptoms, as a physical symptoms, and all those things I have described. And after that, we have discussed about the symptoms of the neck. If there be any problem in the neck, because there are different organs, whenever I described any part of the body, I described what are the organs over there, what's their function over there. So ultimately, if organ is not working normally, it means functions is not normal, or even the organs may not be normal, it will be showing outwardly signs. Those signs I am discussing with you, and we have discussed till now the signs of brain damages, whatever the organ may be in general. Ultimately, we will discuss the different organs, the different problems inside the brain. And after that, when we will discuss about the organs or the of the neck, what the structures are passing through the neck from the head to downward, from downward to upward, and if there be any problems, that will be shown in those symptoms. In this way, we are at the chapter of chest. And when I was discussing about the skin, about the chest, I have described everything about the formation of chest, how this chest cage is formed from the back side, vertebral column, front side, sternum, and I have described about the vertebral column, I have described about the sternum, and then the cage is formed by the ribs, and I have described about the ribs and their description as a whole. All the 24 ribs, 12 on one side, 12 on other side, 24 ribs, and how they are arranged inside the chest, I have described everything, and then about their joints, how they are joined in the back side with the vertebral column and also with the sternum in the front side. So everything I have described. And after that, I have discussed about the organs inside the chest. What are the organs inside the chest? We have described about the heart, we have described about the lungs, and we have also described about the mediastinum. So about the mediastinum, because about lungs and heart, everybody knows. Everybody knows about the lungs. Everybody knows about the heart, whether they know their details or not, but they know that these are the organs in the chest. But most of us do not know about the mediastinum. So I have described in detail about the mediastinum, which comes from the middle of the chest. Mediastinum comes in the middle of the chest, from sternum to backward on the vertebral column, in the middle of the chest. On both sides, there is the lungs, right lung and left lung. And in the middle side, there is a heart, mostly on the left side, but sometimes it may be on the right side. That is known as dextrocardia. 1 in 1,000 person have their heart on right side, but mostly every person is having their heart on left side. After that, we have described about the simple description about the lungs, that the lungs have three lobes on the right side, two lobes on the left side, and most of the part of the heart is on the left side. Some of the part, that is from 1.2 centimeter from the mid sternal line, is also on the right side. But all this middle organs, which are going from upward to downward and from downward to upward to the head, it's a pathway. It's a common pathway. And I have described about this thing that it has many common things passing through the chest area, though they are originating from the other areas, from the neck, from the brain, or from the heart, from the lungs, going up and down. And also they are coming from the down abdomen side and going upward, or they are coming from the heart and going downward. So all these structures are passing through this one, and just like the food materials, the food pipes from the mouth to anus, and when it is going mouth to anus downward, it passes through the pharynx, it passes through the esophagus. These parts are inside the chest area. If anything happens in the digestive system and digestive canal as a whole, we cannot say that this part, the mediastinum part, will be spared from that one. No. All the signs, all the abnormalities will indicate more or less signs inside the chest areas, that we will describe later on, that these are the signs if anything happens. The same thing, the bronchial tubes are coming, is a pathway again, from nose to the lungs. There is a larynx, there is a epiglottis, there is a bronchus, right bronchus and left bronchus, going to the both lungs. So these are the structures mainly inside the chest. And after that, the heart things. I describe you about the heart things because the heart is also a part of a mediastinum, middle area. And from the middle area, it is still separated by its own coverage. Just like many times I told in these lectures that every organ by nature has been separated from the other organs by a wrapping coat, by a membrane. By a membrane, every organ has been separated, means its boundary is this one. Just like the heart, I have told you, it's a pericardium type of membrane. That's known as pericardium. That pericardium is the part of mediastinum, but it is a separate part. It has a separate covering, pericardium. The same way, the lungs are covered in a wrap that is known as pleura, and that pleura is separating the lungs from the ribs cage, and also from the heart as well, from the pericardium, you can say as well. So they are separating all these things, but they are also, this heart is also the component of the mediastinal portions, esophagus, bronchus, and heart. Main blood vessels are also passing through the mediastinum. The blood vessel, which is issued from the left ventricle of the heart, goes upward and is turning backward to the vertebral column, that is known as aorta. Has different sections. First of all, ascending aorta, then arch of aorta, then going back towards the vertebral column and going downward. It's known as descending thoracic aorta, means within the thorax. And also, from that arch of aorta, two arteries are going upward to supply the brain, to supply blood to the brain, that is known as carotid arteries. So, these are the structures inside the chest. We will discuss each and every part of mediastinum. If ever there be any problem in the esophagus, if there be any problem in bronchus, if there be any problem in the you can say the aorta, thoracic aorta, what will happen? What will be the signs of this one? And how we can understand that this is because of the digestive system, this is because of the heart, and this is because of the bronchial tubes. So everything I will differentiate and I will tell you in the simple language in my other lectures. At this time, we are discussing the heart. And about that heart, in my previous lectures, I have described about that this heart is a central organ. The responsibility of this heart is to supply food material and oxygen to the to every tissue of the body from head to heel, which contains food materials and oxygen mainly. In this way, through the blood flow, everything is supplied over there. And then about the heart, I told you it has four chambers, two atriums, two ventricles. But two atrium and two ventricles, all these things are having one common thing, the one common wall, atrioventricular septum. Atrioventricular. There is a wall. There is a wall that all left side is separated from the right side. In the right side, there is a upper atrium, right atrium, and there is a right ventricle. On the other left side, there is a left atrium and left ventricles. But all these things do not have any link with each other, except when the fetus is in the mother's womb. Before it is born, it has a different structures inside that one. So in this way, I have described you that right side of the heart has no relation directly. They have relations, but they do not have the direct interference with each other. And what's going on? Then how it was working inside the mother's womb. And I told you that normal routine of the blood is from collected blood from all around the body is going back to the heart in the right atrium. And from right atrium in our body, it goes to the right ventricle. There is a valve in between that. There is a valve in between that. There is a valve just like a door. Tricuspid. So, when excess blood comes into the right atrium, it is pushed downward. And then from there is a one tube which goes towards from right ventricle to the lungs. That is known as pulmonary artery. And after that, by four different veins, this blood goes to the left side, because I told you it is not having direct relation with the right side or with the left side. So via pulmonary artery, via lungs, this collected blood from the whole body goes to the left side. And before it goes to the left atrium, it collects excess of oxygen from the lungs and dispose of all the garbage of a gaseous type in the lungs, which goes out by the respiration. It goes by the respiration outward from the nose. And but collected air, oxygen, goes into the blood, and that blood goes back to the left side, not on the right side, in the left side and right atrium. And when it is filled by the contraction and relaxations, it is filled, and ultimately the lower and bicuspid valve is opened. And when it is opened, the blood flows downward in the left ventricles, and from there it it goes to the whole body, and all this functioning is done by constriction and relaxation. Constriction and relaxation. When heart is relaxed, it collects blood from the right atrium, from the whole body into the right atrium, and ultimately it goes to the, with a fraction of second, it goes to the right ventricle. And when heart contracts, the heart, this blood from the right atrium is pushed, because it is contracting, pushed upward into the pulmonary artery and goes to the lungs. And the same way, from there, when the heart left side relaxed, the blood comes from the lungs, is filled up into the left atrium, and then after that it contracts, the blood flows downward into the right ventricle, and when the ventricle contracts, it goes to the aortic main artery and to supply the whole body. Now the next thing, when it contracts and when it relaxes, why the blood does not go back? Because there are doors, just like you can say the valves. Just like in the right side, there is a valve which can push blood downwards, it opens downward. One side opening of the doors, you can say. It's a one side opening of the door. And from the right atrium, blood is pressing the blood and open the door, and it goes to the right atrium. But when the heart contracts, there is a valve in the pulmonary artery and right ventricles. It pushes and opens outward. It opens outward. This is known as semilunar valve. It opens outward, and the blood, when right ventricle contracts, it goes upward. It goes upward, and when the heart relaxed, when this ventricle, right ventricle is relaxed, it is not coming back. It is not coming back because that semilunar valve is opening on one side, not on the other sides. So whatever the blood is pushed from the pulmonary artery to the lungs, that blood does not come back to the right atrium. In the meantime, right ventricle is filled by the other blood which is coming from the right atrium, because it's a fraction of a second. Fraction of a second, everything is going on, just like everybody knows love, dove. We know this thing, everything. But this is a fraction of second. All the valves are working. So first thing, it's a coming from the outward to the right atrium, and it does not go back. Second thing, it goes from the right atrium and then goes to the pulmonary artery. There is a semilunar valve. Goes to the lungs. From lungs backward, it is pushed to the left atrium. And ultimately, when that contracts, the valves contracts, it does not go backward to the lungs. And it goes downward. That's bicuspid valves. And ultimately, they again in the left ventricle, when left ventricle contracts, the blood goes in the aortic artery, the big main artery, and there is also a semilunar valve which is also opening on one side. It is pushed downward, it opens like this one, and ultimately when it relaxes, it comes down, but it do not allow the blood come back to the ventricles. And the sequence is going on with a fraction of seconds, contraction of atriums, relaxation of atriums, contraction of ventricles, contraction of and relaxation of ventricles. Simultaneously, everything is working normally, and this thing happens 72 to 80 per minute as a normal human being. But this thing, if it is changed, if it is changed because of some problem in the muscles, some problem in the valves, or anything else from the joining organs, it may change. It may change, then it shows some outward symptoms. This is what we have described in my previous lectures. Whenever anything happens in the chest, irrespective of the heart or the lungs or anything, some of the symptoms are common to every organ inside the chest, and that is the pain. The first thing, that is the pain, because excess of accumulation of anything causes tightness, causes pain, causes a type of pressure. And when there is a excess of pressure of this kind, see, first thing, there will be difficulty in respiration, just like we are moving 14 to 16 times per minute as an average normal human beings. It will not remain the same, maybe less, maybe more, maybe fast, because of this one thing, that the required oxygen dose is not completed, the requirement is not completed, and the lungs has to move more fast, more than 14 to 60 times, it may be 40 times. And ultimately, to supply this short supply for oxygen to the whole body, because it is not all the containers, they are not filled completely, and they are not having the sufficient oxygen to be completed within 14 to 16 per minutes. That is why the lungs are moving more than 16 times per minute. And the same way, to supply this thing, to complete, or you can to fulfill the demand of the body, heart has to work more. The same way, the heart normally palpitates 72 to 80 per minute in a normal human being. It's a different in children, it's different in old people sometimes. But normal thing is this one. But ultimately, lung heart has also to work more to complete the demand of the supply of the oxygen. In this way, whenever this thing changed in the lungs, in the bronchus, in the heart, anywhere, so all these symptoms are the normal structural symptoms which we see outwardly or expressed by the sick patients, that pain and lightheadedness, because he is not having sufficient oxygen. If the head is not supplied sufficient oxygen, automatically the person will be feeling in lightheadedness, unconsciousness type. Second thing, pressure, because there is a excess of congestion, excess of working inside that one. It causes the congestion and tightness, then shortness of breath, because it has to work more to fulfill the demand of the oxygen in the body. In this way, shortness of breathing. And then, if it is concerned with, but this is differentiating symptom. If it's concerned with the heart, there will be swelling in the distal part of the bodies, mostly the distal parts. And in this way, there will be swelling, and also the fatigue. Suppose if the oxygen is not supplied, if we do not eat food at one time, and there is a time, somehow we can bear it for 1 or 2 hours or 3 hours. Ultimately, we will feel fatigue, tiredness. Without food, it's difficult to work. In the same way, when the oxygen is not supplied sufficient by the blood circulations, the body feels tired, fatigue. This is the normal. And when you know, everybody knows, the heart has to palpate 72 to 80 per minute, but if there is a deficiency and demand is more, then ultimately there will be irregularity of the pulse. Irregularity of the pulse is also indicative of this thing, the deficiency, dizziness, because when a quantity of oxygen is deficient, which is not allowing the brain to work normally, then it is indicated by the dizziness. The person will feel dizziness, blurry visions. He will sit down because of the fatigue. All these symptoms are there. And then ultimately, just like we are trying to compensate sometimes work, we have a workload, and we are trying to compensate the workload. Under those conditions, there is a nausea. Without food, without water, without all these things which is required, ultimately you will feel nauseatic tendency. Without food, without oxygen, it means the deficiency, and that causes, you can say, the reverse order of the enzymes produced in the stomach, and then the peoples are having nauseatic tendency. So these are some of the things I have explained in these lectures previously in my Punjabi or Hindi lectures. And after that, I told you about some physical signs. We can see that, just like told many times, the clubbing nails are the indicator of the any problem in the lungs and the heart. Yellow pages indicative of the internal damages in the liver, cracking of the fingertips, and also of the cracking of the bad nails, and all these are indicative of the deficiency of the different salts. So in this way, most of the internal damages are indicating their self by the external signs. In this way, excess of sweating, because the garbage is excess in the blood, in the body, and it is circulating into the blood backward, but this is not cleaned sufficiently, and there is excess of gases and all that. And if this type of condition happens, the garbage is not removed normally, that will create a problem, and that causes sweating. So that skin works. Skin works. Whatever the blood goes to the skin and whatever excess garbage is there, skin tries to expel it out by means of sweating. So that's why cold sweating, cold perspirations, we say, when there is any problem in the chest, and anxious, we are anxious about that one. There is a problem in the heart, there is a problem in the lungs, there is a problem. Such type of problem is excess beyond your limits. Ultimately, you see cold sweatings, and that cold sweating is the indicator of that whatever excess garbage which is not relieved by the urine, by the stool, is going to this in circulation to the skin, and skin wants to expel it out, and that is by means of sweating. So cold sweating is the indicator that excess garbage is there, and skin is working for that one to remove that one, whatever the garbage is coming over there. So is in this way, anything happens inside the chest with any organ, it's also indicative of dry cough. When any car is moving in a normal speed and normal working, there should not be any problems. And when you are fast running and every day, ultimately you do not take care of all these things, then there will be dryness. Then there will be deficiency of the mobiles and all that. You will see smoking and all these things. The same way, there is a dry cough, frequent respirations, more than a normal, 14 to 16 times, more than a normal. it dries up the air passages, which causes dry cough. So it's also a normal symptom of the chest problems. Any of the chest problem may be there. So all these things what I described here, all these things which I described here, if all the things are happening with any person, ultimately that person will become anxious. He will become anxious. And when the person is anxious, his behavior will change. Behavior automatically will change. Suppose he is suffering from any problem in the chest, heart, lungs, or even he is having excess of gas formation, indigestion, and he's having burping or anything. Because I will describe this mediastinum as well. What are the signs of that one? But if he is having any this kind of problems I describe you, and you are asking, oh, what we have to do today, and you are asking any working problems, whatever type work you have, he was, yeah, forget that one. I'm suffering from my complaints, and you are asking about the work. His behavior has changed. He is irritated, more irritated, because he is not covering up to maintain his body functions. How he will work outside? No, he do not think about this one. So this is the main thing. Under these type of conditions, when oxygen is deficient in his body, when the with food, yes, with food we can sometimes live without food for many days, just like Darshan Singh Feruman, 81 days, and many people can survive for more days in this way. But we cannot survive without oxygen, and the maximum period is 3 to 5 minutes. And at that time, you are supplied by a deficiency of oxygen, and it is an increasing time to time, increasing time to time. Deficiency is increasing time to time. Whatever quantity is required by the body is not completed by the respiration or by the circulation of the heart, or maybe obstructed by the indigestion, and the food pipe is passing through the mediastinum in the chest. Under those conditions, it will cause problem for the respiration, it will cause problem for the heart, because they are attached organs inside the chest, and ultimately the behavior will change. So all this dizziness, and sometimes if the garbage is not removed, automatically weight will be increased. Wastage should come up, but wastage is not coming up normally. It means the weight of the body will be increased. So all these conditions I have explained you are concerned with the chest. Other lectures are going about the heart failures. Other lectures are going, because in my last lecture it was in Punjabi at that time. So in Punjabi I have explained about the heart failures. What is actually heart failures means? Then there are different categories of the heart failure, congenital heart failures. And I have explained, I will explain in English as well, what's the congenital heart failures. Basically, first thing I will describe in my next lecture, what is heart failure. And after that, there are different categories of heart failure, just like congenital heart failures. That's like the congestive heart failure, CHF. That's mostly spoken in the hospital, CHF, congestive heart failures. The other thing is right-sided heart failure, left-sided heart failure. Why we say when the heart is one? Why we say right-sided heart failure and left-sided heart failure? I will explain the details, how heart functioning is working. As I told you that there is a septum, atrioventricular septum. It is separating the right side of the heart and the left side of the heart, and their function is also separate. In this way, a problem on the right side is the problem of the right side. The problem in the left side is the problem of the left side. How? Everything I will explain in my next lecture. Please remain attached with these programs. And if ever you think these are beneficial and you get some knowledge out of it, then please convey this message to all other your relatives, the nearest and the dearest, so that they can join with me on my Facebook and also in YouTube, and they can download this app of the Sabrang radio station every day from 5 to 6 is my program, and it's going on since 30 years in America. And I am describing this body, how this life was started from sperm and ovum, what are the complications at every step, how this life was going on, what are the complications at that time, what are the deficiencies, that there is a sterility in the male and females, and step by step how 280 days this life has spent in a mother's wombs, what was going on there, what are the complications over there, everything systematically I have described. And if ever anybody wants to know about those lectures, yes, they can go to my YouTube channels, and you will find over there thousands of lectures, thousands of lectures of these kinds, how this life was created, how this life was developing, what were the hurdles and the way of this life, and how this comes up from mother's outward, and that's the labor, and describe the labor, and after that how this life has developed step by step and step by step, and after completing this whole structure you call the young man, adult man. And at that time we started this structure, that what are the organs inside the head, what are the organs in the neck, what are the organs in the chest, and if they fall sick, if there is any problem in any of the organs, what are the external signs that a general person can know. So these are, at this time I'm describing that what are the external signs of any internal damage inside the body. And we are passing through the chest. We have already described the head, we have already described the neck, and we are passing through now the chest. And what are the external signs of any organ damaged inside the chest? So this is what our lecture is. So I again request to all of you that if you learn something, if you understand these are beneficial lectures, please convey this message to your nearest and dearest, so that they can understand one thing. These lectures are delivered one day in English, the other day in Hindi, or other day in Punjabi. So three languages I am covering, so that every person who understand English, who understand Punjabi or Hindi, they can understand easily in their own language. And my examples are mostly very common examples, household examples, you can say that, so that everybody can understand easily. As we were teaching in medical colleges, that is a different style. That's a different style, because we know the persons sitting in front of us, they are well known to the biology. Many things pass on. But here we are describing that I understand that all the people who are listening every day, 60, 70 people are listening, they all are not known to the biology. They all are not known to the physiology. So we are using the simplest word to explain. We are using the simplest examples, so that you can understand all these things. So Rabha, God bless you all. And this is Gurdeep Singh Sandhu, your homeopathic consultant. If ever and any time you want to consult me for any disease, you can call me at 408-687-1899, or you can email me your questions and get answered. Homeo Medicine, HOMEOMEDICINE at yahoo.com. And thank you for listening. God bless you all. We'll see you tomorrow. Tomorrow perhaps not, because I am going for vacations up to Sunday. And most probably, I will come back on Monday and will resume these lectures on Tuesday. So, excuse me for that inconvenience if you had, because today is Wednesday, and Thursday, Friday, Saturday, Sunday, and Monday I will be back, but I don't know whether I will be able to come in time this 5 to 6 p.m. at California Standard Times. But I'm sure that I will deliver this lecture on uh, Tuesday, definitely. So we will join this program on Tuesday. Rabrakha, God bless you all. Thank you.